Well, good morning, everyone. And once again, welcome to another live this morning. And nice to have you on with us for Q&A Friday. Okay. We want to say hello to everyone here this morning. Well, probably not everyone, but you know that. We like to do a little roll call. Let's see, who am I going to see? Numero uno this morning. And it's Janice. You're number one on my hit parade. Andrea, Niagara Falls, Sandy, Fergus Falls, Minnesota. Thanks for coming on. Brahim's on with us this morning. From Portland, Oregon, Lucille, how are you? Nativity, how you doing? Sandy. Chilliwack, British Columbia, and Kathy in Simcoe. Brahim's having his coffee. I had mine already. Yvonne, Petawawa, Rosalinda, the Kidneys of Canada, Niagara Falls. Hi, Sylvia, in SSIPPI. Madeleine, Bonnie, Georgie, Shelley, how are you? Paula Joe is on with us this morning. And Dennis from Norwich. How are you, Dennis? Brahim saying hi to Kev. Is Kevin on? I haven't seen his name. Shelley, Laurie. Some people get up in the clouds and I have no idea why. Laurie's from Cambridge. Helga's saying hello. Wendy from Aylmer. Rosa, Montreal. How are you, Rosa? Cecilia, Shediac, Nouveau Brunswick. Tara from Petrolia, just outside of Sarnia. How are you, Tara? Diane, Peterborough. Gail, Mount Pearl. Nellie, nice to have you on. Carol from Wasaga Beach. There's Kevin. I missed you, hey, Kev. Sorry, Kevin. I only call out hi, Denise. Luella, West Tennessee. Linda, New Brunswick. Kevin, Brahim saw you. Rita, New Brunswick. Janice is already having her second coffee. Carol is up in the clouds. Marlene, I know many of you. Some guys, I don't know why. I have no idea. Bonnie, Manitoulin Island, beautiful. Wanda, Ridgeway. Rose, good morning. And Milika, how are you? Cecilia said I missed her too. Mary, how are you? And Sandy, those clouds. Lisa, and Wendy, Wendy from Markham is in the clouds too. Patricia, good morning. And guys, we love you. Thanks for coming on. Hi, Elaine. And Doris from Kitchener. Doris, you are more than welcome. Fran, you're in the clouds. I'm going to say Yolanda's probably in the clouds. I'm going to say hi, Joanne. And Mary James from Southern California is saying hi to Dave and Helga. Lori, Rita, Dave, there you go. And Nina, how are you? Okay, let's get to the questions, guys. Brandy, and not our Brandy, another Brandy. Wanda, I missed you too. Dave, I don't know what happened, guys. The clouds were heavy this morning. Diana. So Brandy's asking, okay, a couple of things. She's had her blood work done and hormones done. And so let me get to the question. And her naturopath wants to put her on bioidentical progesterone. I got no problem with that. Okay, I got no problem with that, Brandy. I used to do bioidentical when I was in practice. I did bioidentical hormones. They're natural hormones. They're identical to your hormones. They're not synthetic. They're natural, bioidentical. Do I like them? Obviously, I used them for years in my practice. I like progesterone. I'm just going to say it. I don't like estrogen. I know that, many physicians use estrogen, especially the synthetic version. very, very reluctant. And I'll tell you why again, because estrogen is a growth hormone. I'm not saying you don't need estrogen. Of course you do. And I'm not saying that as you get into perimenopause or menopausal years or postmenopausal, your estrogen goes down. I'm well aware of that. The issue is whether you take estrogen. And I'm a firm believer in progesterone, elevating progesterone, and dimming out the xenoestrogens. Those are the mimic estrogens, because we live in an estrogen-filled world. It mimics estrogen. All the toxins and the pesticides and the herbicides and all the stuff, and even the microplastics and all the chemicals that we use in our homes and everywhere, your body is bombarded with that stuff. So I want to protect people from that. I've always loved the dim. That's why I love flax seeds. And if you want to get a prescription for a bioidentical hormone, even though they're natural, I'm not against that. Not even a bit, okay? Not even a bit. Deb, what is the protocol to help with possible tumors in the breast? Well, I really talk about that. If you can, Deb, go and look, as you go into the Doctors in podcast, look at all the episodes, okay? You can do that. And you can scroll and find out when I talk about cancer, okay? And I have some on breast cancer. So here's Dr. Martin's protocol. I talk about this all the time. And when it comes to breast cancer for ladies, lower your estrogen. Lower the xenoestrogens. Lower your insulin. 2 growth hormones. Estrogen, insulin. And insulin is food. Lower your carbohydrates. Cut out your sugars. Because cancer, okay, grows. Cancer grows with fuel. And the preferred fuel of cancer is sugar. There's no doubt about that, guys. Okay? There's no doubt about that. There are so many studies. And like I said, you go back to 1928, we knew that then. Okay? With the research of Otto Warburg, the ravenous cancer cells. They use fermentation. They need sugar. Okay? They need sugar. And the other thing, okay, that I suggest, okay, so knock estrogen down, dim it out. 1, knock insulin down. Number 2, food, especially sugar. Cut it out. Cut it out. One of the things they've shown when it comes to tumors is high DHA. That it acts like a Trojan horse on a tumor. Comes in and blasts that tumor away. High DHA. Vitamin D. Remember, your immune system does not work without vitamin D. You need the sun. When you can't get the sun, you better be taking vitamin D. And your vitamin D, and I talk about this in different podcasts, we've wrote about this, to get your blood levels of vitamin D, which you can check, to optimize the levels. In the United States, near 60 NGMLs, 60 to 80, even to 100. And in Canada, it's 2.5 times that in MNOL-L. And that is, so 150, 200, those are good numbers for vitamin D. Even above that to 250, okay? To optimize your vitamin D. So that's generally my protocol. I always like curcumin. It's very anti-cancer, curcumin. Okay. Okay, that was Deb Shelley. Her daughter was diagnosed with POTS, which is an autoimmune, where you get the abnormal blood pressure. It can sink like the Titanic when you stand quickly and that. And you can have an autoimmune form of this. Look, anytime you even think of the word autoimmune, like if I had a patient with POTS, for example, and like I did all the testing anyways, like you just have to understand where I come from, Shelley, is this, okay? I always look for deficiencies. I always look, like I tested for so many things, okay? And did they have leaky gut? Yeah, any kind of autoimmune, leaky gut. Were they low in vitamin D? Often. Were they low in vitamin B12? Often, okay? They had the yeast coming out the wazoo. Fungal. Fix that. And oftentimes they had metabolic syndrome, meaning that their insulin and insulin resistance was elevated. Fix that. Food, eggs, meat, and cheese. It's amazing what happens when you go low carb. I would do the reset. It's a 30-day program. And tens of thousands, hundreds of thousands have used that program with great effect in just regulating your insulin, because it was formulated to fix insulin resistance at the cellular level. Okay? There you go. That was Shelley. Marion. Long-term use of prednisone. Well, listen, for inflammation. Let's say you have rheumatoid arthritis. Okay, I think somebody else asked me about the rheumatoid arthritis. Let me just see if I can answer this at the same time. Okay, hold on. Yeah, somebody had, here it is, Janice. What can I take if my RA numbers are high? Okay, so rheumatoid arthritis. And if your RA numbers are high, you might not have it, but there's a good chance that you do have an autoimmune. Rheumatoid arthritis is an autoimmune condition. Here we go with autoimmune, okay? So the question is asked, what about long-term? Like I've seen people with severe rheumatoid arthritis that have been on prednisone for years, okay? And the second they get off of it, enormous flare, okay? Now, again, okay, I never would tell a patient to come off prednisone. I never did it in my office, so I'm not going to do it now. What I would say to a patient that was severe rheumatoid arthritis, they were on prednisone, I said, look, stay on your prednisone. We're going to change what I see of the deficiencies or the conditions, underlying conditions that you have, okay? We're going to clean up your diet for insulin. We're going to lower all inflammation markers as much as we can with food and supplements. I would have these patients on whatever they were deficient in. Usually they didn't get enough omega-3. You need that lubrication. I would have them on pine bark extract with the Navitol. I'd have them on curcumin. I'd have them on usually quercetin, very anti-inflammatory, okay? So I would put everything, probiotics for sure. And we cleaned up their diet, okay, big time. We got rid of leaky gut. And then we see if we could lower their prednisone. And many people found that when they did that, they cleaned up their diet and optimized their levels of vitamin D, optimized their levels of B12, optimized their levels of omega-3. They found they got better. Now, I'm not saying cured, better. Okay? Their pain and inflammation went down. And then they were able to wean down on prednisone. Like prednisone, guys, here's the problem with it. Prednisone, when they discovered prednisone, I can tell you that when they discovered prednisone, it was one of the greatest discoveries in medicine. Why? Because it was an anti-inflammatory that worked. Okay? It worked. The problem is the boatload of side effects of it. Okay? That's a big problem. And it suppresses your immune system. It can damage your adrenal glands. Very serious side effects. But you got rheumatoid arthritis and you can't live without it. So I always said, let's minimize the side effects of the prednisone. And let's see if we can't wean you down and wean you off, possibly. Possibly. Look, when you got rheumatoid arthritis, you need a miracle. You need godly intervention because it's a very, very a serious condition. But I used to tell people, I'll put my results up against, look, I'm not, again, prednisone is working and you need it. And I understand your frustration. You don't like taking it. But, you know, it is a wonder of modern medicine. And you do everything you can to try and help yourself. And like I said, my results with these patients were good. I mean, not cured, but better. Okay. Thanks for the question. And that was, hold on, what's that? Marion. Okay. And there's no, is there any methotrexate, they've used other things, but pain is so draining. Marianne, we're on your side. I feel for you. Okay. Marie, descending bladder. Well, a couple of things in women. Okay. There's a couple of things in women. Descending bladder is rare, and it's rarer in a man. Like a man, when he's going to have problems, he's going to have prostate problems. When a woman has problems down there, their bladder descends. It's part of progesterone. So your bladder is a smooth muscle. Your smooth muscle needs progesterone. And as progesterone, think of what progesterone is for a minute, guys, okay? Progestation, progesterone, okay? Pro-babies. Well, you get older. Listen, I saw it in young ladies too. They didn't have enough progesterone. They were estrogen dominant. And remember, it's a teeter-totter. And you want to be equal between estrogen and progesterone. And when it's unequal, it's always the other way. It's always estrogen is up and progesterone is down. So I like to elevate progesterone. And I really I really saw great results in a descending bladder. Okay? I mean, there's exercises you can do, but I was into elevating your progesterone and dimming out your estrogen. And because again, smooth muscle, progesterone. It's a very important hormone. Okay, that's why we have we have it in our to elevate progesterone in our menopausal formula. Okay, thanks for that question. Much appreciated, Marie. Kim, Dr. Martin, what is your take on ozone treatment? I got no problem with ozone treatment. For tooth infection versus antibiotics, never even thought of it. Never heard of any results with ozone versus an antibiotic. Now, guys, listen, if you got a tooth infection, generally, I mean, if you could take ozone and it would fix it, I just never, I've heard of ozone therapy, but not really for an infection. Now, you would use it maybe on a leg infection or whatever. It would help the healing. But if you need an antibiotic, you need an antibiotic. Guys, you know me. I'm not against antibiotics. I'm against the overuse of antibiotics. You have a raging infection, you need an antibiotic. And the best way, and this is research, guys, the best way to take an antibiotic is, because they always, and still today, even though the research has confirmed what I'm going to tell you is true, it is not best to take an antibiotic take it because it might come back, the infection might come back, finish the antibiotic. No. Take an antibiotic for a couple of days. When your symptoms subside, take probiotics. Take the probiotics, double up, triple up your probiotics. And then, as your symptoms subside, use oil of oregano. I'd put that higher than ozone treatment. Oil of oregano and probiotics. So, but if you, guys, I have to emphasize this. If you need an antibiotic, you need an antibiotic. But you can minimize the side effects. You can replenish, regenerate, renew your microbiome, even when you had to take an antibiotic. That's what the wonderful discovery of probiotics are. They're on your side. Replenish, fix. Anyway, okay? So ozone, I like ozone. I used to have an ozone machine in my office. I did. I liked ozone therapy for mold. Okay? For mold. I liked it. Okay. That was Kim. And Kim's asking about coffee. Does decaffeinated coffee have the same great effect? Yep, because it ain't the caffeine, guys. It's the bean. The coffee bean. If it's decaffeinated, make sure, if you get decaffeinated, make sure that when they do the decaffeination process, it's called Swiss water process. That means it's natural. There's no chemicals used on the bean to decaffeinate it. Decaffeinated coffee is very good for you. Okay? It is very good. I drink decaffeinated coffee anytime after noon. Like I usually have, okay, this is me, okay? I usually have 2 or 3 coffees in the morning. 2 for sure, 3 sometimes, okay? And I guarantee I'm going to have a decaf at night. Because if I have a real one, I'm up all night. Okay? I think the day I hit 50 that's what happened to me. Because I used to be able to drink coffee just before going to bed. Wouldn't bother me. But it does now. Okay? And remember, coffee is the real vitamin C. Okay? Joanne is asking about, she's been diagnosed at 72 years old. You're still a puppy, Joanne, at 72. You're a pup. You've been diagnosed with high-risk osteoporosis. Okay, so what's the question? I read that 4 or 5 prunes daily is incredibly beneficial, on par with some of the drugs prescribed for osteoporosis. I don't know where you read that. Joanne, like it wouldn't be my first choice for osteoporosis is prunes. The first choice is vitamin D, okay? Like optimize your find out what your vitamin D levels are and go for optimization, okay? And if you can't get in the sun every day, then you better be taking, well, you should be taking vitamin D anyways, okay? I'm a big guy on not taking calcium, but K2. That's why we put K2 in our vitamin D in order that, because vitamin D, everybody knows vitamin D, and that's all the doctor knows. Oh yeah, vitamin D is all right for your bones, but be careful. That's 99% of all physicians. Because they never studied vitamin D. They don't know what it really does, other than, oh yeah, it's helpful for bones. But you got to be careful, you're going to get toxic. That's what they learned in school. And so they know nothing. And I'll tell you something else, okay? I'll tell you something else, Joanne. Heavy lifting, okay? Lift your own body. Like if you can do a push-up, do a push-up. You can buy those little bars. I have them here, as a matter of fact, for doing push-up. Get strong. Elastic bands, okay? Bands. Stretch it, strengthening. Bones need weight. The stronger your muscle is, the more the muscle has to anchor itself in the bone. The bone builds bone when your muscles are strong. They build bones because those muscles anchor in to your bones, and your bone, you build more bone because of your muscle. One of the biggest issues is sarcopenia we have in society. People don't have muscle. They have muscle wasting. And so strengthen yourself. That's better than almost every vitamin, other than vitamin D and K2. Eat eggs, meat, and cheese. Why? You get vitamin D in food, and you get K2. Okay? You get protein. You need protein for your bones. Lay off the sugar. Sugar is very destructive. Is there anything that sugar doesn't destroy? It'll destroy your bones too. And you get caramelization of the bones. Okay? Glycation, we call it. Thank you very much. And that was, I don't, by the way, I'm just trying to think why someone would say 5 prunes a day. I gotta, like, I know what's in prunes, but is there anything there specifically for the bones? Eggs, meat, and cheese is better than prunes. Okay. Joanne, thanks for the question. We love you dearly. Stephanie, this is a very good question, Stephanie. I'm glad you asked it, okay? So Stephanie is finding out that we live in a crazy world, okay? You have sausages, and you have bacon, and they got pepperettes. They are very low carb, and they got a little bit of dextrose in them, okay? It's packaging. We don't live in a perfect world. You're not living on a farm, okay? I don't think. So you go to Costco, you go to Walmart, you go to your grocery store, and you're reading labels. Am I happy you read labels? I am more than thrilled that you're reading labels, okay? I am more than thrilled. But this is the big but that I'm going to mention here, okay? Stephanie, here's the big but, okay? When you are on the Titanic, don't worry about the deck chairs, okay? When you're on the Titanic, don't worry about the deck chairs. What do I mean by that? Well, if you have metabolic syndrome, you have elevated insulin, you have inflammation, your blood pressure is up, you got extra weight, your triglycerides are high, and your HDL is low. That's metabolic syndrome. You have visceral fat. You have belly fat. And now you're on the Titanic and you're trying to fix it. Well, don't worry about the deck chairs. Not right away. Don't worry about the furniture. Okay? So when, like a lot of people have sidetracked themselves, they get so focused. Well, there's a bit of dextrose in that product, therefore I will not eat the bacon. Look, if you can get 100% natural, no sugar added, no nothing added bacon, and I know that's available. But don't get into the weeds, I used to tell my patients. I said, look, and trust me for 30 days. When I say go have bacon and eggs, if your eggs are not free range, I'm not going to shoot you. Just do what I tell you. I want to give you a plan to succeed, not to fail. Failure is when you get into weeds and I can't eat anything. Dr. Martin's reset's no good for me because I can't find anything that doesn't have sugar, a little bit of sugar in it or whatever. Don't worry about that right away. That's what I mean by that, because I was a very practical guy. When I tell you to have bacon and eggs, I mean it. When I'm telling you to have sausage and eggs, I mean it. Well, Dr. Martin, I looked at the label. I'm not saying don't do it. I'm just saying eensy weensy teeny weeny yellow polka dot bikini, a little bit of sugar in there. I'm not worried about that. Believe you me, when I say you're going sugar-free, you really are going. If you have a gram or 2 of sugar a day, I mean, that don't even register on the Richter scale. So I'm just saying to you, get the big picture first. Pat yourself on the back. Be encouraged. You want to have a pepperette? I encourage you to have a pepperette. It's better than any granola bar, chocolate bar, anything that they say is good for you. Don't believe it for a minute. A pepperette is better. Why? You don't need insulin. That's the key. When you lower your levels of insulin, your cells become sensitive now to insulin. They become sensitive. And that's what you want. Now your inflammation markers go down. Now your triglycerides go down. Your HDL, your good, all cholesterol is good. Cholesterol goes up. Okay? Your blood pressure comes down. Your kidneys say, thank you. Your eyes say, thank you. Your brain says, thank you. Your heart says, thank you. And your liver is empty. You've emptied your liver. So that's why I'm glad you asked me the question, so that I can reinforce where I come from. Now listen, I have many disciples here, many students. Now they've graduated and they're into their postgraduate work. What do I mean by that? Well, they are experts on labels. And they know how to find the best brands, the best products, the best eggs, the best meat, steak, the best, you know what I mean? They're postgraduate people. And I love those people, of course. And, but when you start out, it's so important to get the big picture. Okay? It's so important to get the big picture. And when I talk about this stuff, there's good, better, and then there's best. Okay? So that's the way I think. Good. Are pepperettes good? Absolutely good. One of the best snacks you can have. Okay? Better than nuts. You don't need insulin. That's the key. That's the key. Okay. Let's see here. How many more do I got? Because I think we got a show coming Monday. Okay. Well, I thought I answered this. Derry was asking, what do I think about root canal surgery? Well, look, I'm not an oral specialist. Okay. The problem with root canals, okay, is that oftentimes, okay, you got a dead root in there, and it's a breeding ground for bacteria. And it's silent. You don't even know it. And that can spread. One of the things that they know about oral is that had, and this, I remember doing a show in radio years ago. Oh my word, almost 30 years ago on oral bacteria and pericarditis or heart infection. And this was 30 years ago, at least. And so there's a connection. If you have a root canal, probiotics, oil of oregano. Every day, brush your teeth with oil of oregano. Okay? I love that. It kills unfriendly bacteria. Okay? Don't kill your good guys, only the bad guys. Don't you just love that? Okay. And probiotics. Okay. Okay, let's leave it at that, and we'll do the rest of it on Monday, Lord willing. Okay, yeah, there's some good questions there. I got to answer them. So let's do that. Okay, so guys, thanks for coming on this morning. We appreciate it. We love you guys dearly and sincerely. And if I haven't answered your question yet, we'll get to it in our next session. Okay? Talk to you soon.